Welcome, everyone. My name's Jeri Schaff. I work for Valley Program for Aging Services. I'm thrilled with the number of people that have registered for our presentation today, which is one of 5 in a series called Medicare 101. This one is Turning 65, and it's going to give you a very basic overview of Medicare, what the parts are, how you enroll, when you enroll, as you're approaching eligibility, so that we don't have any problems with feedback. Please mute yourselves. Just click on the little microphone on your toolbar and it'll mute you. That way, as I said, we don't have any problems with feedback or background noise going on. So we're going to get started. We will answer questions after every section, but if something occurs to you and you're afraid you're not going to remember till we get to the end of the section, please feel free to put your question or your comment in the chat box. So what is Medicare? It's federal health insurance for those who are 65 and older, younger people with certain disabilities or medical conditions. Most people are eligible to enroll in Medicare when they reach the age of 65, but there are a few exceptions, such as if the person has never worked for wages from which Medicare deductions were withheld, and certain permanent residents who have not lived in the United States for a specified period of time. Those who are under 65 who are receiving Social Security disability benefits are generally eligible to enroll in Medicare after 24 months of receiving Social Security disability benefits. State disability benefits or private insurance disability benefits don't count toward that 24 months. So Medicare has 4 main sections. Part A is the hospital section. Part B is the medical. Part C is Medicare Advantage. And Part D is prescriptions. Parts A and B are also called Original Medicare. So if you hear me talk about Original Medicare during this presentation, I'm talking about Parts A and B. So we're going to go much deeper into the details of each part of Medicare in future sessions, but here are a few things to remember. Part A covers inpatient care in a hospital, not emergency room care, not observation status. So what it does cover is inpatient hospital care, skilled nursing facility care under certain conditions, hospice care, and home health care under certain conditions. Part A can be used at any provider that accepts Medicare anywhere in the United States. There are no networks or restrictions. As long as the provider accepts Medicare and is in the United States, Part A can be used there. Now, Part B is the part that covers most everything else. It covers office visits, physical therapy, labs, imaging, other tests, and most other allowable services that are delivered as an outpatient. So it's doctors and other healthcare providers, it's outpatient care, it's home health care under certain conditions, durable medical equipment like walkers and wheelchairs and shower chairs, and preventive services. And there are a host of preventive services that are covered under Part B at no cost, no deductible, no co-insurance, no co-payment under Part B. And that again can be used at any provider that accepts Medicare anywhere in the United States. Part C is Medicare Advantage. And this is the one that you see advertised on TV a lot. What it is a plan that is from a private company that is Medicare approved and offers an alternative to original Medicare. So it offers coverage that replaces Part A and Part B. They often offer prescription coverage. Usually their services must be obtained within the plan's provider network, and the available plans vary by zip code. You could have a plan that's the ABC premium plan in Virginia in your zip code, and your sister-in-law in St. Louis could have a plan called the ABC Premier Plan, and they won't be the same. They change by zip code, and it requires a fair amount of investigation and information to make sure that you're getting what you expect to be getting from Medicare Advantage plans. One thing that does happen with Medicare Advantage is that what you're doing is exchanging your Part A and B coverage from federal government to the private insurer, but you still have to pay the Part B premium. Part D is prescription insurance. These are all offered by private companies. They all have rules that they have to abide by that are put out by Medicare. They cover all or most of the cost of most prescriptions. They almost all have deductibles, annual deductibles. They cover several recommended vaccines. Some prescriptions are not covered, and nearly all over-the-counter drugs are not covered under Part D plans. And again, the available plans vary by zip code. There's an upcoming session that's devoted exclusively to prescription drug plans. But the takeaway here is that these are plans offered by private insurance companies, not the government, although they do have to meet the government's standards. So does anyone have questions before we go on to talking a little bit more about each of these parts? Okay. So here are the costs and the limits on these parts. For Part A, which is hospital insurance, it has no premium for most people. You or your spouse must have worked and paid Medicare taxes for 10 years or more for it to be free. That's the vast majority of people, although we have had clients that did not work for 10 years and have Medicare taxes withheld. And we have had clients who are foreign nationals who are permanent residents who have worked for 10 years or more and had taxes withheld, but they have not been resident in the United States for the required number of consecutive months. So in 2022, the Part A deductible is $1,556 per benefit period. That's not an annual deductible. That's a deductible per benefit period.
Which is?
And the benefit period is described as you have not used Part A benefits. In other words, been an inpatient in a hospital for 60 continuous days. If you have a condition that has you hospitalized pretty frequently, your benefit period could extend for quite a period of time. But once you are out of the hospital for 60 continuous days, a new benefit period starts, and you have a new deductible of $1,556. Once you've paid that deductible, in this year, the co-payments for the first 60 days are $0. For days 61 through 90 is $389 a day. For days 90 to 150, it's $778 a day. And after day 150, you pay the entire cost. That is per benefit period. So it's not that if you are if you're being hospitalized very frequently, you end up with, say, more than 60 days within your benefit period, then you're going to start to pay. But if you're not, then every time you pay a deductible, your benefit period starts again with these co-payments. Part B is your medical insurance. Again, this can be used at any provider that accepts Medicare anywhere in the United States. There are no referrals required. You do have to check with the provider to be sure that they accept Medicare. In 2022, the premium is $170.10. Don't ask me why it's 10 cents, but it is per month. It is more if your income is more than $91,000, if you are filing your taxes separately, or $182,000 annually as a couple. And that is as is reported on your tax filing of 2 years ago. They will go back to your tax filing 2 years to check and see whether or not your income is high enough to require an extra payment. In 2022, the Part B deductible is $233 per calendar year, and that's per calendar year. There's no benefit periods. Co-insurance payments are generally 20% of the cost of Medicare approved services or items after the annual deductible is met. Again, in another section of this, in another session, we will go into what we mean by Medicare approved services. And the premium amounts are set by the Centers for Medicare and Medicaid each year in late fall. Now, if you're not yet receiving Social Security, retirement, or railroad retirement benefits, you can pay the Part B deductible directly to the Centers for Medicare and Medicaid on a quarterly basis. Until I hit my maximum earning age, I was doing that, paying quarterly, putting it on my Discover, so I got some cash back. If you are receiving Social Security, retirement, or railroad retirement, the premium for Part B will be deducted automatically from your monthly payment. Medicare Advantage, you have to be enrolled in Part B and you have to continue to pay the Part B premiums to enroll in Medicare Advantage. It can be less costly than original Medicare for many people, but there is often a trade-off in how or when or where you can receive covered care. The premiums, the deductibles, the co-payments, the co-insurance amounts vary by plan, but all of the Medicare Advantage plans have an annual out-of-pocket limit, and that is something that original Medicare does not have. They all have a limit after which you pay nothing once you've paid that amount out of your pocket. And that can vary anywhere from $4,000 to $15,000 a year. The premiums can and will change on Medicare Advantage plans every year. Their coverage, in some instances, can and will change every year. They must provide all the coverage that's available with original Medicare, but the costs may be different. Instead of a zero copayment after a $1,500 hospital deductible, they may say you have no hospital deductible, but you're going to pay $350 or $400 or $450 from day one. So it takes a little figuring to figure out whether or not that works for you. Almost all of the plans include prescription insurance. There are a few plans that do not, and they are very specific, mostly for veterans who are getting their prescriptions all through the VA. The available plans vary by zip code, and they very often require that service be obtained within a provider network and that you receive referrals for specialist care within the provider network. You can switch from one Medicare Advantage plan to another every year. So with prescription insurance, you have to be enrolled in Part A, not necessarily Part B, but Part A, to enroll in a prescription insurance plan. And the premiums vary by plan. This year, it's anywhere from less than $10 to more than $100 a month. If your income is high, you will pay a surcharge just as you do for the Part B premium. And the premiums can and will change every year. This year, deductibles on those plans vary from $0 to $480. Co-payments are based on the drug's tier. There are 6 tiers. The ones that are most often used are 1 to 4. And tier 1 is generally the older, generic, cheaper drugs. Tier 4 is brand names that are not often used and often very expensive. So your co-payments can be as little as $0 to as much as the full price per refill. And your co-payments can vary depending on the pharmacy you use. There are pharmacies that are in-network or preferred pharmacies, and pharmacies that are not. And the co-payments will change between preferred or network pharmacies and non-preferred pharmacies. If you don't enroll in a prescription drug plan, when you enroll in Medicare, you may and probably will be assessed a late enrollment penalty. And we will talk more about this in our whole session about prescription drug plans, but the late enrollment penalty is a penalty for life. It will go on as long as you have a prescription drug plan. Now, if you choose to go with original Medicare, you have costs. You have an annual deductible for Part B. You have a per benefit period deductible for Part A. And Medicare generally pays 80% of the cost of approved services. So supplement or Medigap plans help lower your share of the cost when you have original Medicare. There are multiple plans with benefits, but the premiums are not the premiums the same from all. That was a very poorly phrased sentence. There are multiple plans. Their benefits are dictated by the Centers for Medicare and Medicaid. Their benefits must be the same. If you have, they all have letter names. Wouldn't you know? We have Part A and Part B and Plan A and Plan B. But if you have a Plan G, no matter which company you buy it from, you're going to get the same benefits. They are dictated by law. The premiums are not. So this is another case where it pays to shop around. The premiums are based on which policy you choose, your age, your zip code. Other factors can change every year. The premiums will increase as you age, and they must be purchased through a licensed agent or directly from the company. We at VPAS and our certified counselors cannot enroll you in a plan because we have no skin in the game. And selling these policies involves a commission. So we cannot enroll you in a Medigap plan. And quite frankly, we cannot give you as much information because it's not available to us as a licensed agent can or directly the company itself can. There's another whole session. The next one, as a matter of fact, that talks about Parts A, B, and supplements. We'll talk more about supplements in that one, but there is something called guaranteed issue when you first enroll in Medicare Parts A and B. So does anybody have questions at this point? You guys are quiet. Okay. So let's say you're approaching 65 and you want to enroll in Medicare. How do you go about doing it? It's actually pretty easy. If you're receiving Social Security retirement or railroad retirement benefits, you'll be automatically enrolled in Parts A and B. And your Medicare card will arrive before the month in which you turn 65. If you turn 65 on June 19th, you will get the card no later than May. It often comes 2 or 3 months before your birthday month, but your coverage will be effective the 1st of June if your birthday is the 19th of June. If you're not receiving retirement benefits, you can go to the Social Security website, which is ssa.gov, to enroll, or call your local Social Security office for an appointment to enroll. The Social Security offices have started to reopen for in-person services, but they are very, very good at telephone services. Do not dismiss those. You have to call and leave a message and they will call you back and set an appointment. But when they say, I'm calling you on the 22nd at 1 o'clock, you better be by your phone because they will be calling. So when do you enroll? If you don't enroll in Medicare when you're first eligible, you'll incur a late enrollment penalty, and that is, again, a penalty for life, unless you or your spouse is actively working and covered by an employer group health plan. An employer group health plan is defined as group coverage through an employer that has 20 or more employees. So folks who are working for small businesses or who are self-insured are not part of an employer group health plan. You have, or your spouse has to be actively working. So COBRA doesn't count. Paying it yourself doesn't count. You can self-enroll in Medicare 3 months before the month you turn 65 and no later than 3 months after your birthday month to avoid that late enrollment penalty. That's called the golden window. You'll typically pay an extra 10% for every year you were eligible to enroll in Part B but didn't, and that penalty is added to your premium for Part B. So are there questions about enrollment? Okay, so what if you're still working after 65? So you're covered, or your spouse is actively working and you're covered by an employer group health plan. You can delay enrolling in Part B without incurring a penalty, but you should still enroll in Part A. It's free unless you continue contributing to your health savings account after the Part A effective date. If you have a health savings account, you know it, and that is employer group health plans that have a very high deductible and offer their employees a chance to contribute pre-tax earnings to the health savings account to pay towards their deductible on a payroll deduction basis. If you enroll in Part A, you need to disenroll in your health savings account because it cancels not only the tax benefits, but it makes Part A the primary payer. You see why we need another session just to talk about Parts A and B? But now's the time, if you're still actively working, to compare the costs and the coverage between the current plan you have through your employer and Medicare. The cost of health insurance to employers and to employees has, as most of you know, just skyrocketed in the last few years. And for some people, it is more cost effective to enroll in Medicare than to keep your employer group health plan. Some employer group health plans will require you to enroll in Medicare Part A and B and will provide you with supplementary coverage through your health plan at work. Now, if you are in a situation where you're getting Social Security or railroad retirement benefits and you're actively working and covered by your health plan at work, you'll be auto-enrolled in Parts A and B. But when that card comes in the mail, you can flip the piece of paper over and you'll see a place where you can sign to decline enrollment in Part B. You sign that, say, no, I only want Part A, mail it back to them, and they'll cancel your Part B enrollment. Another question that comes up about enrollment in Parts A and B is, what if I'm covered by a marketplace plan? Can I keep my marketplace coverage? The answer is no. Once you reach the age of 65, your marketplace coverage will cancel, except in very specific circumstances, and you will be required to enroll in Medicare Parts A and B or not have any coverage at all. Here's a bunch of things that we've already talked about. Under the Affordable Care Act, you don't get an exemption for continuous coverage. Coverage under COBRA doesn't apply because the insured employee must be actively working. Now, if you know when you or your spouse plans to retire and lose health coverage at work, you should enroll in Part B 3 months before that coverage ends. You can have it effective the date that your coverage ends, but you should get enrollment process going about 3 months before it ends. If that's the case and you've enrolled in Part A, are covered by an employer group health plan, are retiring, going to lose that coverage, it requires 2 paper forms to enroll in Part B. One you complete and just says, I want to enroll in Part B on this date. And the other one your employer completes, and it certifies the length of your coverage at work and that it was continuous and that it is creditable coverage. Many employer HR departments have these forms on file, but you can also get them on the Centers for Medicare and Medicaid website at cms.gov or on the Social Security website at ssa.gov. If you're going to do these paper forms, please mail them both in the same envelope to your local Social Security office, and you can find that address on the web, or upload both forms together on the Social Security website. There's nothing like trying to track down 2 pieces of paper that go together, but were mailed separately and are on 2 different desks in a Social Security office. So does anybody have questions now? Okay. We're going to be taking a deeper dive. This has been just brief, very brief overview to introduce you to what Medicare is about. As you get closer to being eligible to enroll, there are a lot of things to consider, and we've just barely touched on them. I think you all got an attachment to your reminder email that was the path to Medicare, and you can see it's not simple. So we encourage you to register for the rest of this series. On April 12th, we'll be talking about Parts A, B, and the Medicare Medigap plans. Prescription drug plans on May 10th. Medicare Advantage plans on June 14th. And then enrollment periods and the fine print on July 26th. You can go to our website That's vpas.info/education to register. And we encourage you to do that. And we're here to help. Medicare Insurance Counseling is one of our signature services at VPAS. We have more than 20 state certified counselors, and they are available to give you personalized, confidential, unbiased information. We have, as I said before, no skin in this game. Our primary objective is to get you what you need to make an informed decision that's the best decision for you. So if you'd like to request an appointment with a counselor, please call us. Call your local VPAS office. You can call toll free at 800-868-VPAS, or you can email vpas@vpas.info. If you're going to email us particularly, please tell us not just, I'd like an appointment with a counselor, but tell us who you are, where you are, and how we can contact you. I'm encouraging you to open your mics if you choose and ask any questions you have. Do we have any in the chat box, Sarah?
We are all good on my end for questions.
Okay. Does anyone have questions, comments?
I'll ask one. So you said apply 3 months before, so that means that means 3 months before your birthday, or 3 months meaning the first day of the month?
3 months before your birthday. It can be the longest period of time that they will allow is 90 days before your birth date.
Okay, thanks.
Anyone else? Comments, questions? Okay, we're going to be sending out, I will be sending out to each of you a link to a survey. We are trying very hard to improve the quality of the programs that we provide, and we are still finding our way through the technology. So we are going to be very interested in your comments. You will get an email from me. It will have a link to a Survey Monkey. The survey has 10 questions, shouldn't take you more than 5 minutes at the most to do. And that will go out either late today or sometime tomorrow. If we have no further questions, I will thank you all for your attention and hope to see you again next month.
One last comment. If you have not put your name in the chat box, I need your first and last name so you can get that survey. So if you just want to unmute yourself and say your first and last name, I think there's only like 2 or 3 of you that I'm missing at this point, but please tell me your first and last name so you can get that survey and tell us how to improve our programs.
Okay, I think we can stop recording, Sarah. And we have recorded this and we will make it available on our YouTube channel, but it takes a while for that to happen.